Dr. Bains here, and this video is on endometriosis and LDN. Now, LDN stands for Low Dose Naltrexone. It's a drug that was around from the 90s, so it's been around a really, really long time and used for addictions. At the high dose, which is 50 milligram. Now, at a very low dose, which is why it's called low dose naltrexone, you're talking about less than 10th of the original dose, so less than 5 milligrams. It has a completely different function in terms of what it does to your body. So what it really does is that its job is to go and block human opioid receptors in your brain. So this is just a receptor, it goes, it blocks, and when it blocks, it always triggers this negative feedback loop, and your body goes like, oh my god, we don't have enough opium in our brains, let's make some more. So what are human opioids? Human opioids are things like endorphins, dynorphins, and enkephalins, and all the fins, all the good stuff. And what are endorphins? Most people know what it is, that sense of feeling great, after you've had a really good bout of, let's say some people like exercising and they get that real high after sex, you get that real high. That's endorphins. Now imagine being able to make that artificially, all by tricking your body. That's all it does. LDN blocks the receptors, tricks your body into thinking there's not enough. You now have a surplus of it, and because it's such a tiny dose, it gets out of your body really quickly, and now you have all this spare endorphins running around doing its job. What are its jobs? What are endorphins there for? Besides making you feel good, it's a highly important immunomodulator. It works brilliantly for pain in many patients, not everyone unfortunately, but we do see it working a lot. So we currently use it for a lot of patients with any and every autoimmune disease. We find that it can make a difference. Fatigue type syndrome like chronic fatigue, fibromyalgia, and anything which has inflammation. So endometriosis really sits here. So although research is a little bit limited outside within the research world, anecdotally, what we see in the clinic is that we're loving our results with our patients. Once again, it may not work for every single one of you. Sometimes there's so many other factors, but I tell patients, stick to it, keep at it. Sometimes it takes a little bit longer in some patients, and we have seen an uptick of people who are reading about these research, and they are coming and they are looking for doctors who are able to understand where LDN sits within the whole treatment modality for endometriosis.